Okay, so let's try.
Everyone, we're about to go online, just to let you know. Ready? Yeah. Good evening, everyone, and thank you for attending this meeting of the Children and Young People Overview and Scrutiny Panel. Understand it's a bit of a busy room this evening, but if we can all do our best, that would be much appreciated. So I'd first like to start by welcoming everyone to the meeting. I would like to take this opportunity to remind everyone I expect you to treat all members of the committee with respect and to report this same respect to your officers. This meeting is being live streamed and recorded. I have apologies for absence. I have apologies from Linda Kirby. Brenda is here as substitute. Thank you, Councillor Fraser. And Councillor Charles will be joining online. Councillor Austin has informed me he's running slightly late. Item 2, declarations of pecuniary interest. Are there any declarations of pecuniary interest? Thank you very much. Minutes of the previous meeting. Can we confirm that minutes of the meeting on the 10th of September 2025 are a true and accurate recording? True.
Agreed.
Thank you very much. Much appreciated. Now, as a note, we will be taking item 9 as item 5. We're moving that up the agenda slightly. But we will begin with the budget and business planning, the purpose agreement. So I would like to invite Councillor Alan Brutus to begin.
Thank you, Chair. Thank you for the invitation. Now, this oversees round 1 of budget scrutiny, and unlike in many other boroughs, we also have a second round of scrutiny on our budgets in the new year, which I know everyone's looking forward to as well. Our budget is dedicated to supporting and enabling the delivery of Merton's vision, and in particular to our 3 strategic priorities: nurturing civic pride here in Merton, building a sustainable future for everyone, and creating a borough of sport. We do face a challenging environment, Chair, higher expectations of residents and customers, growing demand for our services, and this is coupled with constrained local government finance. But we will persevere with providing an excellent service in children, lifelong learning, and in families. Now, let us remind ourselves that scrutiny is an all-party and non-party affair. In that spirit, I want to thank all councillors on scrutiny, all my cabinet colleagues who are here tonight, Sally and Osama. Thanks also due to our Saturdays team and all officers, especially those who looked into ensuring our equality impact assessments are spot on. And finally, I want to thank the scrutiny officers and the democratic services team for their help in putting the arrangements together for tonight. Thank you, Chair.
Thank you, Councillor Alan Brutus. Would you like to lead us through? Yep.
Chair, so just to reiterate some of the things Councillor Brutus said, so this is the first few sessions. Each session is actually made up of 4 individual meetings. This is the 3rd and 4th, and then it finalises tomorrow night with open scrutiny, and that concludes this round of scrutiny. So, in the report you have on your agenda, this presents savings that have been put forward, some 6.1 million across the council, including 1.3 million from Children's Lifelong Learning and Family Service. That's what we're here to discuss today. But just an overall picture, the financial pressures, like across the country and in London, do not subside, unfortunately. So there are still pressures in adults and children's social care. Temporary accommodation is now our singular most acute financial pressure, but also we get the significant challenges that come with the running of the DSG and what risk that poses to us. So as I said, these challenges are replicated across London and the country. So we are coming back in January. We have another £5 million worth of saving to find, given the gap. There's a couple of key events coming up nationally which affect local government. The budget, the national budget tomorrow. So we'll dissect that and see what that means, if anything, for local government. And then we'll have the provisional local government final assessment, which essentially is our allocations. And it's very difficult to really get a feel for our funding for future years, but the provisional settlement will give us figures for Merton, but also for the first time in a few years, it will give us a 3-year settlement We've been having single year settlements each year, which has been challenging to plan in the medium term. So the settlement will land, I think, week beginning the 15th of December. So Christmas is council for the accountants. We'll be busy crunching numbers and meeting mince pies, and we'll present that back to members on January the 19th cabinet, as well as perform further saving performance to meet the residual gap. And then this final session in February with the Budget Council, but also we also get the final settlement with those changes that happen into the original and the final. So one of the biggest impacts on local government is the fair funding 2.0 review. That is an attempt to equalise some of the funding formulas, to simplify them and create differentials in weighting around them. The detail of the report has all our consultation responses. That is in line with a London Council's response, and there are signs that some of the housing costs which London particularly have compared to the rest of the borough are being incorporated in some of the thinking. So again, we won't know until we get to the legal settlement, but all the details is in the report, and that's going to really impact on what starts funding over the next 3 years. So,
Thank you very much. Now, as I've usually done before, we will divide questions on the budget between the MTFS report and then the wider. And so I would like to invite speakers on the MTFS report first. Councillor Hayes, Councillor Fraser, Councillor Henry.
Thanks, Chair. Just on the send table, how do you want to improve that?
I'm sorry, could you just say that?
So, on the send table, seems to be increasing.
There's an increase in the take up for children with special educational needs and disabilities. Yes, yeah.
What's the dynamics of that? Sorry.
Thank you, councillor. So I think your question relates to the increase in the numbers of children needing education, health and care plans because of special educational needs. There are a number of factors leading to it. One, this committee will remember previous updates and reports that we entered the safety valve. And as part of the safety valve, the DFB committed to building us a much needed special school. That was a commitment set out in as early as 2022. For a variety of reasons, that promise has not been delivered. And so we've not had the facilities that we need to hold and contain the needs of our children with EHCPs, particularly post the experiences of COVID, where much of the agency involvement in children birth and up under the age of 4 will remain unknown to us. And I think we peaked in September last year, the number of children come to school with undetected needs around special education and disabilities. So not having the resource we need to hold our children in Merton has impacted on how we have had to manage them outside of the local authority boundaries in independent schools. So some of the factors affecting those children, speech and language difficulties, not having an early intervention in school age offer, issues around the complexity and the acuity of multiple disabilities, but still having every entitlement to be educated, and one that this borough and all of us on this table are committed to achieve. The crisis with the DSG and the high needs block nationally, as we are not been spared of that crisis. And whilst we've done everything that we can do under safety health conditions, we always tried to go further and faster and more focused to address the rising needs with limited resources.
No.
Can I just give one quick sort of mention? Not a question, more a statement, Chair. It's like the issue of the and then it's been brought back another year. Is that right? The government study on the same day.
Yes, so the date, the timeline has been pushed back. There is some expectation that we'll have the white paper for January, but we wait to see.
Thank you.
Thank you, Beth. That's much appreciated. What I'd like to do, given how stacked the agenda is, I'd like to take questions from groups of 3. So I know I have Councillor Fraser and Councillor Henry. Is there a third question on the MTFS? We'll take those 2.
Thank you, Chair. So this is for finance person. And what is the impact on Merton of the government's fair funding policies?
Councillor Henry.
Oh, okay, thank you. Thank you for the report. Anyone can answer this question. What is the latest news on a possible government white paper on the historic DSG deficit that all councils are facing?
And one final one from me, if I may. The report sets out a number of savings proposals across 7 separate tranches that you're intending to bring forward, more than 1.3 million next year. How confident are you that those savings will be achieved? Take those.
I'll take the first question. I think Councillor Richardson and subsequent one. So the modelling we've done with London councils on the impact for Merton for next year, it's showing a deficit of 300,000 on our funding, but rising to 7.6 million by the end of our MTFS period. These are based on the initial consultation, and these will change based on the feedback that we're getting, and we won't ultimately know until December, but we are modelling that based on sort of London Council figures, which is at the whole of London. So it is a challenge. It's sort of the impact is staggered over those 3 years, so councils aren't getting the impact in year 1. So it's something that we will sort of have to live with as part of the assessment. But until we get the final assessment in December, we won't know exactly what those figures are. But that's what we're modelling based on the information we have.
Thank you very much.
I'm going to come back in on question 2 and 3. So the same white paper, Councillor Henry, is now rescheduled to be with us for January. There are a number of national issues that have to be considered, and it was felt that that should be put back to hear the final feedback from the various sources and agencies that are supporting central government with what that paper should look like for consultation. So in January, we will be able to update you on progress. Question 3, the issue was confidence in delivery. So it's really important for me to say that we would not be putting forward these savings if we were not confident that we could deliver on them. The question is not about how easy it is. The question is confidence in delivery, and CLLF have a history of delivering on their saving targets.
Thank you very much, Councillor and Beth. Are there any further questions on the MTFS? I will take Councillor MacArthur, then Councillor Fenner, and Councillor Hall.
Thank you. My one is, I've got 2, but I'm going to just do one now. It's concerning the proposal with the Joint Commissioning ICB and CLLF. Now, in it says a couple of times, if this proposal, the ICB will fund half of the saving, that's how the saving is going to be made. What if they don't?
Chair, you want to take them?
Sorry. Councillor Fenner.
My question is also referred to the ICB. It says that you will reduce duplications. What type of duplications?
Councillor Hall.
Thank you. You say you're confident that we can deliver these savings, but in previous years, not so much last year, the year before, only 76% of the savings were actually achieved. And I'm just wondering how you're so confident that these savings can be achieved.
Thank you, Beth.
So I'm going to start with the ICB Joint Commissioning. It is no secret to this scrutiny that from the very outset, certainly my start with Merton, that we were moving towards a Section 75 agreement with the ICB. We've had the best part of 9 months since we first made the declaration that we wanted to enter into a shared, jointly and equally accountable budget sharing exercise for our resident children in Merton. Part of the confidence in this proposal relates to the fact that the CAM service through the ICB, it has gets the grant to do some of the things that we're doing internally. It is using that lever to give us the confidence to continue with this as a saving target to ensure that that's part of our first joint and equally accountable service delivery. If the ICB, and I will state with a small I and small f, does not award us the grant, and there's much conversations happening now, then we will reduce the service as said in the papers.
Sorry, so that is the savings stay the same, but the service will be reduced. That's correct.
And it will read and it will focus on the most vulnerable children, open to social care and inclusion. We hope that that will not be so, but until we see the signatures on the dotted line, we are using the language in.
That's fair enough, but there's no alternative. So that if little money doesn't come or the joint funding isn't available, there's no alternative to reducing the services. Is that correct?
That is correct. And I'm going to move to the third question around duplication. And I'm not sure that I entirely understood it, Chair, so I'm going to ask for a repeat so that I answer exactly.
Councillor.
Thank you. I'm just going back to the year 2023, when only 76% of the savings were actually achieved. 24% were not achieved. I'm just wondering how confident are you in the figures here and your ability to deliver the savings that have been set out here?
So, Councillor, I'm very grateful for that repeat and expansion of the query. It's very difficult for somebody like myself to answer for a period that I was not here. But what I can say is there's a process that me and my team have followed that gives us the confidence that we want to put these forward and assure Scrutiny and others that the 100% saving target that the CLF has achieved and the 87% overall saving target that the council's received previously is assurances that we ask you to hold on to. The question is not, and I'll just repeat this because these are difficult times, it's not that whether it's easy, it's whether we can deliver on them. Yes, we can.
Councillor.
Yes, unlike them, I've been here a bit longer, so I delivered 10 balanced budgets when I was leader for 10 years, closed the council tax for 6 years. You referred to a year when, yes, the savings were not as encouraging, but last year 86%, this year 87%. We're very confident we're in the right track, the right direction we travel, but we will make these savings. Thank you.
Along the Councillor Pamu's question.
And I got rather excited then, Councillor Pamu, I've forgotten your question, I'm sure.
It was a question about the duplication. So you said you're going to reduce duplication. Could you point out what are the duplications, please?
And in respect of what saving?
It comes under the ICD.
So
ICD and CAMS.
So the grant that comes in from central government and from the NHS comes to our what's called the integrated care board and is allocated to meet the mental health support needs part of it of children and adults in this fund. We are in a unique position in Merton where we have our own in-house CAMS and the cost of that comes from general fund. What we're trying to do is realign all the joint commissioning arrangements that the responsibility and the ownership of delivering those needs sit with CAM services, and therefore minimises the duplication. We don't want 3 or 4 pathways for children to have to access their needs. We want to create a single pathway, but because of the particular needs of our children in care, some of the children on child protection plans, we have really supported what others have applauded as a valuable in-house service. But we are negotiating to make sure that children's needs, health needs, mental health needs are met by the mental health specialist, or that they jointly fund so that we can keep this valuable service. And so that's the duplication. We shouldn't have all those pathways open. We want to reduce them. I hope that helps.
Yes, thank you.
While we're on the ICB, give us an update on the status of negotiations.
I'm going to invite Christina Pace into that, but I witnessed this week, if it's helpful, the conversations that the commissioners in my service and in the ICB were holding. So Christine? Yeah.
Thank you, Beth. So, with regard to all joint commissioning with the ICB, which is wider than just the CAMs that we're talking about today, we've identified 6 priority areas that go from joint support and funding for mental health through to ensuring that we fully and fairly fund packages of care and placements for most vulnerable children. Those high-level priorities have been agreed by our ICB partners and endorsed at Health and Wellbeing Board and at our Joint Centre Governance Board. And what we're doing now is putting flesh to the bones, where we've agreed with our ICB partners that we will have detailed commissioning plans for each of those priority areas to make sure that we are either jointly funding, jointly commissioning, or making sure that our funding and commissioning is aligned to meet the needs of our children and families.
Thank you very much, Christine. It's very, very sharp to hear. Can I ask for any final questions on the MDO? And then we'll move on to the wider.
Yeah, this is the Family First Partnership, where it seems to me you're getting a grant from the DFE, which is going to be used to do a different service, which means you can reduce the service that you're already offering, which would deliver 533 savings. What I wondered is this a one-off grant that will set that programme up, and then what happens in future years? Because if this is a one-off grant, what will happen when that is withdrawn, or how the savings continue, or will you need to?
There was some sort of more of a clarity just to fully understand. So one of the things that was mentioned is there's a realignment of the general fund to sort of what seems to be to top up the DSG. And I just wanted to clarify how I correctly understood that, just that is that something that we expect to have to happen continuously because we're not expecting enough money to come in from DSG years to come, or is that expected to be something like a one-off situation?
Thank you for that question. So, as you know, we sort of deliver school services on behalf of the government, so we get given a ring fence direct school grant, which we administer on behalf of them. Being part of the DSG means essentially whether the deficit as a balance on our balance sheet. Now, what's obviously happened with the high needs element of that, there's been a significant shift in terms of the money we get and the costs that we incur, and the set out. There's lots of reasons for that, and we are doing a lot of work around managing those. But essentially, the system has been created in a way that these are escalating costs. One of the decisions we took last year, so what we used to do is where there's a deficit, we put that money aside in a reserve, essentially for the day when the override runs out. So the override is essentially a government mechanism to say all that deficit that you're accruing will essentially allow you to set a balanced budget and sort of move on and create that deficit until you have a plan to deal with that. So on the back of the announcement of a white paper in this financial year, We took the decision not to accrue for the full amount, just because it was a significant burden on the taxpayer in Merton. So we stopped accruing to the full level of the deficit, and we are awaiting what the plans are from government in January. So that'll essentially give us our next steps, and that's where we are at the moment now. So you're probably taking things here.
Does that mean so what, if we're expecting that information in January, you will have full information that be accounted for by the time it comes to the budget?
Yes, so the plan is, depending on what the proposals are in January, we will reflect those in our medium-term economic strategy in February. If we won't be in time for the January cabinet paper, just because of the timing of it, but we will make a decision on essentially what the future is of dealing with the deficit here locally in February.
And will be Councillor McCarthy that.
Very helpful, really helpful question. There is a lot of activity in CLA. I'm trying to finish the building blocks of transforming the system. So many of you will remember that Joshua Coaster did a review of childcare and suggested that the transformation needed to rebalance the system so that we could in the preventative space and we protected the preventative space so that the needs of children could be addressed without trickling into statutory services. So the grant that's been provided is to help the system with its design and rethink across the country and learning from the 10 pilots. Now, for Merton, the allowance that we've been given is to bring in specialist support to do that significant transformation. And just today, we had a wider conversation with our partners around what that design would look like. And we are using the grant to ensure that health, police, the voluntary sector, our schools, and other partners that have not formally been invited into the preventative space have got the ability to inform the design, and the grant will be used for that purpose. Then the expectation is that we will manage the benefits from having children not in high cost placement, not in statutory space, not needing camps, not needing 3 or 4 different open and shut episodes within the statutory sector, being able to stay home safely. That's what we balance the system, and then that is what we are using as our building blocks for predicting future NTFS and this. So we don't know that we're going to get enough grants. We believe there is some indications that we will be given a grant for another year, but until I see it, Councillor MacArthur, we are using the HIP.
So just to clarify, it does sound great. I completely agree with you. It should be this angle we should be working for. You think that this grant and the work that can be done with this grant will make a saving by 530k in future from what was there before?
I think we see the grant as an enabler. The grant will enable a massive transformation of the system by having a short-term injection of specialists working with us. In the long term, it will wash its own face because you see nationally the pressures on the children in care places market particularly, and some other challenges we have with child protection.
I just one final question. If you don't get another grant, but do you foresee the money that you have for this grant being sufficient to make the saving that you're saying?
Yeah, I think it's I think that we do expect that more money, the grant will be extended for another year. And that expectation has some assurances because the new minister is clear that he feels that learning from the 10 pilots, that we do need a subsequent year of grant to help build changes in the system. The grant itself will not save money. It's given to us because we needed the extra spend whilst we retilt the system.
Thank you, Beth. I'd now like to move on to wider questions of the Children, Lifelong Learning and Families budget. So can I get a first round of 3 questions? Anyone have any questions? I see Councillor Fraser, Councillor Henry, and Councillor Bibb.
Thank you, Chair. I just want to find out how will the 830,000 under section 31 grant for the Department of Education be used?
Councillor Henry.
Thank you. Can we be told about the changes to government grants within this area?
Which?
Pardon? Children, that's what they are.
And Councillor. Councillor.
Thank you, Chair. What will the participation team and voice of young people function look like after the first change? Thank you.
Councillor Henry, you have a microphone.
I think I would take them backwards. For the 831, I'm going to ask my clerics to come in and talk about with the response to that one. For the changes that the government grant will indicate, again, I'm going to give my clerics an opportunity to contribute to the conversation. And participation, I want to hold that myself, because I'm extremely excited about it.
I think I will be too.
So our participation team are outstanding. They have delivered for us in Merton over many years with a model that we have all agreed works, the policy and the practice. What we want to do with the new reforms is widen the way that the participation team model works so that it becomes everybody's business. It's not limited to a handful of people held centrally here in the civic, but it becomes pervasive across all agencies. So it's the police have a child first commitment for Met. And within that child first commitment, they have started to ask local authorities about how they can ensure children are supported them with the development of many things. So one example is it was children and young people that supported the Met with the development of the village, the soccer search page. And they want to extend that further, listening to the learning in the in health. It is right that we have children who use services being able to be empowered to give feedback about their experience, not coming just to a single source to get that whole piece of work done all the time. In CLLF, we want to hold some of that, the specialisms and the work that we do around a slightly more defined participation team, so we can really hold those expertise and the work that the external inspectors do around a more knottier issue that will absolutely need support from a dedicated resource. But we must broaden and amplify the voice of children in every area of service, use and living.
Thank you.
Elizabeth.
So if I could comment on Councillor Henry's question on changes to grants. It's been quite an interesting year in Children, Lifelong Learning and Families as we get to grips with how grants are changing. So we've referred, the biggest grant that we get from government is the Dedicated Schools Grant, which sits separately from General Fund. But that's a very important grant for us. In terms of other grants that we have at the moment, the Children's Social Care Prevention Grant, which is what Bev has referred to before, which is going to help us deliver on our transformation associated with the national reforms. We've also got a Children and Families Grant, lots of children, lots of families prevention, the Children and Families Grant, which has combined a number of different grant pots that we have previously received, including for Supporting Families programme, which is a really important programme for us in the prevention space. Most recently, we've had confirmed the Best Start in Life grant, which we are looking to see how we are going to be delivering on the government's new proposals
which is particularly around how we bring together services to meet the needs of children in their first 5 years of life. And then we have various other small pots of grants, but we're working very hard to work out how we can actually make the best use of those to deliver for our children and families.
Thank you very much.
And Councillor Grace's question. Oh, go ahead.
Just like to what Elizabeth said, as part of the review of local government finance, the grants that Elizabeth mentioned, there'll be lots of consolidation as well as changes to the underlying formula as well. So that's why we're eagerly awaiting this answer.
Steve, thank you very much. I'm sure. Apologies for the microphones.
Yeah, so as for date, there's a lot of liberty that we've been given to use this grant, but we're spending on it very much sort of in line with the DV policy sort of around London nation as well. So we've brought in a program manager who was the same program manager who worked on our family hubs. So it's really advantageous for us because the family hub is a sort of a key learning thing for that the Family First Partnership program to learn from and it's built on. We've appointed a program development lead, which really sort of lean on the practice and the changes that we want to implement across the partnership. I've brought in some extra program management support as well to support that program team. We've put some money towards sort of officers and diverting them from their business as usual tasks towards the Family First Partnership program as well. There's some of the money that's gone on to data transformation. And that's just some of the examples of how we've used that. It's a very, I've got a very sort of robust system about how we use it as well throughout the LD process.
Thank you.
Thank you very much. That sounds very good. Can we get a second round of questions? Councillor Hall, Councillor Hayes, I'll come in myself as well. So, Councillor.
Thank you. Looking at the participation and engagement, which very carefully set out. I just wondered if, while embedding the new multi-agency and participation approach, would this result in staff possibly having a greater workload in the interim, or how are you looking to cope with that?
That's nice.
Yeah, I'm saying an interest from my previous life. It's all takes to the and that's route optimization. Just on the system, it says it's going to be savings. When this, what is exactly the system? And what's the name of the system? System I dealt with, brought in from Canada. Called postcards, I don't know what in there. But it's just an optimization tool. Tells you, routes and stuff like that. So, what's the name of the system? It's got one. And what we will be saying, there's no question about that. But how does it work? How will it work in practice? And what will be the savings? Estimate, because whoever, I don't mean this pejoratively, whoever stole the system to you, they did with the setup, I imagine. This will produce X number of savings. You've got the computer, tells you the best way to go around, etc. etc. So when it was sold, what were you offering in terms of savings? Aside from that, what were you expected? Convinced of the savings and all to your team, introducing it,
And I just wanted to ask the governor myself, I wanted to ask what the early thinking on the review of the structure of the government services team was.
Thank you all so much. It's good to have committee just really wanting to working with us and understand what this might mean for children and might be being learned. So in terms of the staff work, really helpful. And I refer to page 32 of the participation and engagement pro forma. In that pro forma, from the second bullet point, it talks about a shift to digital engagement using online platforms for surveys and for other sector-led forums such as the voluntary sector and community groups to always measure impact by what children experience with them. This is the transformation, this is the shift. Any service we commission, any engagement we have, we should be building in automatically systems that children and young people, their parents and carers can report back to us the difference it has made to them. It shouldn't be an afterthought, it should be upfront, and when we're designing and sending out and preparing contracts for a tender exercise, that should be baked in to the way that we determine the success measure of how council funds are being used. So that a digital tool, many digital tools. Now, to provide some reassurance, before I took the job, I listened to a podcast that Merton had developed, and it was during COVID, and the findings were captured through an online survey and then articulated by one of our young inspectors. I believe it's still live, but you can have confidence that that method can work and it's everlasting. And it's third bullet point, and I could go on and illustrate, but if that's enough, that's the way we want it. This needs to be taken. We often talk about the industrial revolution, the agricultural revolution, but we're in a digital revolution. Where it's safe to do so, we should use these tools so that our children are more comfortable with this way of feeding back and participating, are able to access it, whatever their language, whatever their background, and whatever their special needs. So I think I've answered that one, and therefore it will not have the impact that we're worried about on staff workload, apart from gathering the information which are dedicated to support us with comms to do. Send transport, I'm going to ask Tom to assist.
Where's my nearest microphone? We have a full report on home to school transport later on in the agenda, which goes through a lot of the initiatives that we've done and are doing, and it's, I suppose, it's packaged with that. So I'm happy to provide a response now, but if I think that will come clear as part of that, the various initiatives we're doing, which are part of efficiency savings.
The chair, you accepted to take the answer to that question later on in the agenda, or do you want it?
No, I'm happy to take it later on in the agenda. I think it might form part of that agenda item. So
and I think that we may have answered the questions unless I've left something. The governor's service will be Elizabeth.
Councillor Butcher, absolutely. Support that we give to our governors is absolutely critical. They are critical to the success of our schools as they provide leadership, strategic leadership for head teachers and the wider school community. So the support we give governors is really, really important. It's a relatively small savings we need to see, and we're looking at this very carefully. It does coincide with the time that we have previously provided certain services, and that is no longer required. So we're looking at how we pull this all together, the structure there, but the support through training, through advice and guidance, through governance reviews will remain.
thank you, Elizabeth. I've had the opportunity to take some of the training myself, and I was very impressed. It's a very difficult time over the next few years. So I'm glad to see that the council is doing great work in supporting governments to get through what's going to be a challenging time for you. So that's good. Further questions for the budget? Then I would like to thank the cabinet member, Councillor Brutus, and others from outside for being with us. And I look forward to seeing you again in round 2. Thank you. Thank you very much. So the next agenda item, moving up to item 9. So we are going to take the 2019 Health Trial Service update. Down here to speak with us all, and anyone else who'd like to come in at any point, please introduce yourself. We are taking, because of the size of the agenda this evening, we are going to take reports as read, but feel free to give us a brief update or a brief comment, anything, and then we will go directly into questions. Thank you very much.
Thank you, Chair. We'll take it as read. I think the key message being that our services are for children and people around 0 to 19 are doing really, really well. As exemplified by increases in checks, breastfeeding rates, and also as an exemplar in London, for example, on the 2-year review, and have made significant improvements since the pandemic. So really good message around our 0 to 19 services, but we've also highlighted in the report around our ambitions for our new contract, which we are now in, and also next steps. So yeah, very happy to answer any questions. I have my colleagues here from CSH, so they'll introduce themselves, answering questions. Thank you.
Thank you, Elena. I just want to take a moment to say it was a fantastic report. I was glad to see that the whole system, the early approach, is positively affecting the lives of families and children and young people across the borough. So thank you for the work that you and your team do. I would like to open to questions now. Councillor Fraser, any further? Councillor, please introduce yourself when you ask a question. Thank you very much. Councillor Fraser first.
Thank you so much for your report. But I just want to know, what has Merton done differently to have a fully recruited school nurses?
Thank you. Yes, I just wanted to ask, how many school nurses do we actually have in Merton? And sorry, sort of 3 questions in one really. The health visitors overall caseload is noted at about 726 children. Is that about average, do we know, for London boroughs? And what support do school nurses give children who have found to be obese? Because I'm sure we're all interested in the whole healthy eating and trying to get our children as healthy as possible. Thank you.
And so I am Inspector for joining us this evening.
I'm just saying, I'm filling in for my colleagues, sorry, but it seems like rambling. But I do ask that, is the FFT report the only way you gain youth feedback? And if you are using this way, are you giving support to those who spread their individual needs to gain their feedback? Ask this as I'm a bit worried within 4.4 is coming from a parent's perspective. The feedback, I'm just wondering, are we hearing from young people directly and how they feel about this and other provisions?
Lots on that list, so who would like to go first?
I'll probably refer to the first question around recruitment of colleagues, Shelley or Nancy. Yes, well.
Hello everybody, my name is Shelley Heffernan. I'm the head of clinical services for children's services and community health my background as well. So the first question was about how we've managed to get fully recruited school nursing and health visiting services. I think we've got something special at Merton. We have a lot of staff that come back, so we have lots of promotion activities as well. And we all often do get good feedback from our staff in terms of like compassion and inclusivity as well. We've got a very active quality, diversity and inclusion programme, and our training as well. I don't know if you know, CLCH has an academy as well, so we ensure that we get all our staff trained. We do what we call stay interviews. I don't think we do that in social care. So we meet with our staff regularly and talk about what development they need and why they need to stay. But we also have exit interviews as well. So staff members don't need to be meet the same day, they can meet someone external. So we always learn from that as well.
Yeah, see what's coming on the question around the numbers of school nurses.
Hi, my name is James Lee, and I'm the clinical lead for health visitors school nursing. Currently we have 6 school nurses, but we use a skill mixed team. So depending on what the school requires will depend on the clinician that will go in. So we have band 4 clinicians who are nursery nurses. So they have a skill in assessing children, they have a CNP program, they provide advice to young people in their family.
We have around 5 staff nurses who also support with schools and primary schools they tend to have. And then we've got our school nurses who have secondary schools as well as primary schools. And they hold a lot of child protection cases, support families with health assessment, see the children at school, clinic settings, or at home. So we do a lot of work in different settings to meet the needs of the young person and their.
But just in terms of the numbers, maybe we can provide the kind of numbers in terms of the different groups.
Sorry, next question. Microphones, please.
I think the next one on caseload sizes. That one is it, yeah. Yeah. So something we monitor monthly as part of our children's services. So CRCH has children's services across London. I think we're the biggest provider for health system across London. And in Merton, we are doing quite well with our caseload sizes. So we're not the highest in terms, we do have some caseloads that go up to that. So at 750 something, that's a good caseload size. And how we manage that is we have a universal element, which is the whole caseload, but the numbers again will be smaller for the children we targeted for. So that's how we tend to focus and redirect our resources. Thank you.
And this is a question on feedback, and we get feedback specifically from our SEN children.
So for the SEND children, all the school nurses, staff nurses, we do have a special feedback form that they can take into school with faces so that they can express how they felt about the consultation that they've received. When they go into schools as well, they give feedback to the young person, they can put it in an envelope and it's just taken away. We do have QR codes as well, so there are different ways that they can give feedback to the service.
Just to add to that, we are also exploring obviously improving engagement with young people. We're exploring a kind of a program called Chat Health, where young people can feed questions or anything around kind of feedback from the services through that. So we're exploring that, and within the next few months we will be putting that into place. So that will help with improving kind of engagement with young people as well.
Let's follow on.
Thank you for that. I wanted to know, is there a way for us to be able to view this feedback as well, or will this only be staying?
Sorry.
Learning the microphones, yes, absolutely. So we do supply yourselves, don't we, monthly at our operational meeting with comments and feedback, which we collect. So we have it, the data, so we can share that. That's what's required. Can I just add as well on SEND? We obviously, our health team, school nursing team, also work with our speech and language therapy and OT team. And we've got the therapist colleagues who work together. So if you're going into a child with special educational needs who hasn't got a voice, we would do that with our speech and language therapists and use Makaton and things like that. So that it's not just through the voice that we get that feedback. We use our sign language and rest as well. Thank you.
Thank you. And you mentioned a QR code for getting feedback. I think that's great. Is that, but I'm afraid that sometimes you can have this QR code and then it kind of gives it away and young people are not using it. Is there a way for them to be encouraged to have feedback within the school so you're for sure gaining this feedback?
Maybe if I could just add to that in terms of engagement in schools. So school nurses go into drop-ins, so they have monthly drop-ins in the primaries and also weekly drop-ins in secondary. So that's an opportunity to kind of gain feedback and share information and, use it as a contact, but also, attend parents' evenings and other sessions and engagement. They train the teachers as well and attend classes for example, for around sex education.
So there's a lot of opportunities where, the service is able to provide that information to young people directly, and make sure that it's used as well, but actually it's really.
So one thing we've developed over the last year is leaflets. We're trying to promote our service, talk about what we do, because with the number of school nurses that we do have, some students may not know how to access a school nurse. So we have a lot of leaflets. We send it out to the head teachers every term, at the beginning of every term, and that has a QR code as well on there to give feedback, information on the services. Giving feedback is one thing, but knowing what we offer is another thing. So we are really out there trying to push what school nursing do currently.
Thank you so much. Thank you.
While we're on that, where are the leaflets normally disseminated to? Where is the main bulk of them placed? Just asking myself.
So the leaflets, we can send it via email, but we have sent it to the head teachers because they're the ones that will disseminate it, whether through their monthly newsletters, information that they're sending out to parents. So we always make sure that we're getting it out there to the head teachers because they will disseminate it.
That's great. Yeah, best place to send it to get disseminated through them. If that's, I said, we mentioned the feedback that is available that you will be able to have a look at. We can get that arranged. We've got that on there a lot. Thank you very much. The second round of questions I have Councillor Henry, Councillor MacArthur, and then Councillor Lemon.
Thank you all for your report. And we're at the Healthy Child Programme. Can you please explain what work took place to get the 2.5 health visitors health review we have now seen?
Councillor MacArthur.
Thank you. I was just looking at the number of children who have been weighed and measured, and that's great, the number that's being covered. But I looked at the report on healthy weight, which is referred to and was presented to the Health and Wellbeing Board, and 33% of year 6 are obese or overweight, 19.1% of reception children are obese and overweight. Trends show there's been no significant changes in the percentage of children starting school overweight and obese, and of concern is the increase in overweight and obesity between reception and year 6. I understand from that report the priority is to develop an all ages healthy weight action plan by December 2025. So my questions are, how is that progressing, and will a child healthy weight report be coming to TYP so we can?
Councillor Lemon.
Thank you for your report. In at 4.18, it says that you're reaching out to all the women that are not pregnant women known to the service, but what are the things that you're doing to reach out to those that are not known to the service?
So I think there was a previous question as well, so responding to the question. So in terms of the obesity work, as you mentioned, we are working, my colleagues are actually on Richard and Helen, but progressing the Eat Well Be Active action plan. We've had a lot of progress on that. In the usual workshop that happened just over the summer, pulled together stakeholders from a range of organisations to look at how what actions we can take locally. We engaged with schools, head teachers, developing a school approach around healthy weight. So there's a lot of progress on the Eat Well Be Active action plan that we're thinking about with actions together with our partners. There's a partnership meeting that takes place that progresses that work, which is a wide partnership. But again, the obesity is there's no single bullet around obesity. The one thing that's going to make the big impact, it has to be a range of actions across a range of things that will support improvements. And in that, we are, it's a priority of the Health and Wellbeing Board strategy.
and it is being prioritised to look at the things that we can do. There's obviously there was a question around the support for children who may identify as services or identify as CLC. It's one part of the 0-19 service that looks at that. But obviously, there's other more universal things around healthy eating, healthy weaning, nutrition, starting in the early years and across through school age as well. But there's a small service that's for family staff that is particular. But I'll refer to the NC for that start.
Okay, so Family Start are children that are identified from the National Measurement Programme. Any child who's identified as severely obese, they are offered a Family Start appointment, which is 3 appointments where they meet with a nutritionalist who will sit with child, parent and support them, give advice on healthy lifestyle. Now, this is voluntary. So we offer it, but it's up to families to decide to take it. Some families will come to the first appointment, and what we find is we get a good number at the first appointment, but by second and third appointment, it declines. So we are trying to engage families. We're looking at ways to offer it, maybe in a group setting. If we've got 3 children in a school, look at maybe going to see them in a school, work together with them, because maybe peer on peer might motivate them to make changes. So we're looking at different ways to offer the Family Start module that we're currently offering. So Family Start is what we're offering in Merton from the children that are identified during the National Measurement Programme.
So well, I've been sitting on this board now for 3 years and I haven't seen an improvement, and these figures don't show me that there is an improvement. So is there going to be the Healthy Start, what's it called, initiative in December, the Healthy Rate Action Plan by December 2025? Is that going to happen? Is that what was said as a healthy, when it was presented to health and wellbeing board? And which initiatives do you think are working? Is there any analysis done of which initiatives work better, or trying different initiatives so people drop out after the first session, as has been suggested? Is there any, have you looked at other boroughs or somewhere else to see what might work? Because I just feel like it's great that you're trying all these initiatives, but the figures are still showing all these children obese and overweight. It's really concerning that we don't seem to be getting a grip on it. And I know it's a national problem, so I'm just saying, what else could we do? And also I'm asking, are you going to bring a healthy weight programme to report, child healthy weight report to CYP? And is there going to be the action plan that you said in December 2025?
So I suppose in terms of obesity, I have to point out that we're not in a different position to anywhere else in London or across the country on the issue, and everybody's obviously working at a national level and policy that will support improving healthy eating, for example, or improvements in physical activity. So just to kind of put that out as an issue. We've worked on the plan is in development, and there'll be a draft of it, but there'll be some iterations around agreeing the draft with partners, with a range of partners. It's not just for the local authority that's kind of working it back against the whole kind of approach. In terms of, I think you were asking about the action plan, and another point around the.
Is there going to be a report to CYP, or is it all going to be the all ages report? That's a we won't see it.
So at the last meeting of CYP Scrutiny, where we presented a brief paper, that was one of the areas that more people's focus report when it comes to this scrutiny. Obviously, when it was prioritised, there were other priorities that came. So didn't make it onto the plan for this year. That it was one of the things that we put forward, and partners, may remember that we put it forward as an item. And
I'm just going to abstain for that in this stuff, so who would like to come in first?
Yeah, I think that's because the memory is really very good. It was a commitment to this committee that we would come back with that paper. It was only because of priorities and the scheduling why that has been pushed back. But we will reprioritise it and work with our colleagues to bring the update. And I think that this is an illustration of whilst public health done a sterling job in leading this rise, there are enablers and dependencies of other agencies to support. And I think we would have one opportunity at our DLT to contribute to payments.
Would be very happy to prepare a paper whenever it's prioritised.
That will be in this scrutiny year.
Gender permitting.
Should we take the question on the 2.5 year review? Is that?
Yes, please.
So, right.
Thank you very much.
So the OC and I did a joint act here, but we've been on a journey since COVID because we obviously at that point we didn't actually screen the children at 2.5. Health team did step down. So we've been on a journey. We've been working really closely with Lena and Rachel, and what we've been doing is been looking at the data, been looking at deep dives to the children who we haven't been reaching. And we've looked at that through inequalities lens as well. So we've looked at data in terms of wards, GPs, looking at their race and ethnicity, looking at it from all angles. And we've brought that data back together and we've came up with an action plan to try and improve the 2-year review. I'll let Yancy tell you what she's been doing with the team.
Okay, so with the teams, it was important for them to understand the neighbourhood that they were serving. So each team would receive a monthly list of children that the admin couldn't reach, and they would go and knock on the doors. So in knocking on the doors, a couple of things we picked up where some people didn't even live at the addresses, but we had them as living at the addresses, so we could move them on to wherever they'd moved on to. And we introduced a reminder text service, so that's doctor to doctor. So if you've got an appointment, you'll get a notification a month in advance and a week before. So that improved all of our data as well. Another thing we've done is partnership working. So that's with the early years, with childcare, we've done training, they know where to find us. Again, we did another leaflet for health visiting, where they know you can contact this number, you'll get to our general spa, and we will be in touch. Your local team will be in touch. So a lot of the work is for us, our local teams understanding who they're serving. So in one area, I'm going to start a project with our QI team. There's an increase in DNA to our clinics. The question is why? Just one clinic. So we are going to be doing some work into that. Why is there an increase, and what can we do about it? Should we visit these families at home? We may have to change things just for that area. So there is work happening to improve the 2.5 year check, but all of the reviews that we're offering to families.
And just to add to that, I suppose one of the simple things that I think the service did were they were checking when they were calling families, they were calling on a withheld number. And a lot of families don't pick up withheld numbers, but they got that feedback from some of the parents, like why didn't you pick up or why didn't you respond? And that was a really simple thing that they changed and used mobile phones or the office phones to call families, and that made an impact in terms of them engaging and agreeing to appointments and things. So yeah, some simple things, but actually it needed to do the deep dive and needed to get the information so we see working with the office as well.
This might be a bit redundant, but do they need voicemails? Because I know if I will ignore a call from an unknown number, but if it leaves a voicemail, I will make an effort to listen to it.
We do leave a voicemail. We also changed our telephone system as well, whereby before, if you left a voicemail, you're calling us back, you go to our voicemail. Now we've got a system whereby you're on a waiting line. So your second, third, you kind of know when you're going to be answered. So we do need voicemails. Yeah. And we have an email as well. Please do contact us when they're abroad to tell us we're not in the country. We'll be back in 3 months. We'll call you when we return.
Councillor Fraser had a question. I have a question. Councillor MacArthur.
There's still one more question.
My apology.
Pregnancy, yeah. So the question was pregnant women not known to the service. So some women will come to us through social care or through their GP or just that they've moved into the borough and given birth. If not every family will know, but once we are notified, we'll make contact. And once they've had a baby, we'll see them between 10 to 14 days.
So I was just going to add, we also have a homeless house visiting team. So for those in temporary accommodation, we've got a really good network with the housing department, and they will, when we turn up, the house visitors are really known to the families. So they get notified that the woman is arrived, she's pregnant, and we'll just go and knock the doors. It's good old fashioned knocking on doors that works, and that liaison.
All of us being in politics, I think we can agree that it is knocking on doors that works. Councillor Fraser, then myself, then Councillor McCarver, and then we'll go to one final round.
As somebody who's worked well, I'm not going to go into the history, but the family hub is something that works well for Merton. And I haven't heard you mention anything about it. But some of these people were discussing, if they knew about the family hub, they could probably come. And so it's just something that you know, why is it not being mentioned?
My question was to take it back to the healthy weight and the family start for a moment. I think one of the great struggles that people find is unhealthy eating is so much cheaper than healthy eating. And so I wondered what specifics were being done on that when, you know, someone can still get a burger at McDonald's relatively cheaply, but a salad will cost them half a day's wages. What we can do to help families there, particularly in the cost of living crisis. Councillor McCarthy.
So I just like to say, cooking classes in schools and things like that are usually very good, but that's just my point. Two questions. One, sorry to do two, is I know that promoting immunisation programmes is part of your role, and I just wondered if there'd been any improvement in the uptake of immunisations for children, because I know that was a concern. I'm not going to explain this very well, but I think it's great how improved your 2.5-year health check are. It's fantastic. Now it says 85.6 achieve a good level. Is there any correlation, or I don't know how you work it out, given that 27.1% aren't checked at 2.5? Is there any concern that those ones that aren't checked are the ones that perhaps might need more help, and how would you go about identifying and helping them?
Family hubs, healthy weight, and then immunisations.
Yeah, in terms of the family hubs, I suppose it's because we're the outside part of it, because we're co-located with in the family. We are the family hub, does that make sense? So that's possibly why they don't talk like that, because we are co-located with our family hubs. We work with them all the time. We go to our lunch and learns. We teach them, they teach us. We're actually embedded within them. So that's possibly why we don't, you know, specifically talk about it separately, because we see ourselves as integral.
Can I just say that it's not everything that looks easy. Everybody knows.
Microphone.
Sorry. Yeah, I said it's not everything that looks easy, even though the sign is up. Everybody knows it. So I think we should still say it.
Yeah.
Just in terms of the healthy eating, I suppose that there's a lot of wider things that we're doing around the food environment, and we're working with our colleagues around that internally and also externally. You may know that we were one of the first boroughs to have an advertisement policy that supported kind of reducing the advertising of high fat, sugar and salt within our kind of boards. So that there is kind of wider work. I don't think I will do it justice in terms of covering it here, but I think the paper will do more justice than I can probably at this meeting. So if I think we can take that into that paper, that I think come back and obviously the progress on the Eat will be active. In terms of immunisations uptake, so in terms of the 19 services, a long time ago, our health visitors used to give vaccinations and things, but that's moved on quite a bit. So our health visitors don't give vaccination. However, they do provide opportunistic and just part of their general mandated checks in terms of promoting immunisations to families. Obviously, wouldn't be able to correlate the advice from the authority services with the kind of improvements in uptake, but that is integral to their work.
So yes, that's every contact counts. So every time we see a family, with it. We'll give health promotion messages. We also share a clinical record system with our GPs. So if we're visiting a family for targeted work, we'll look to see if they've had their immunisations. And if they haven't, then we'll absolutely discuss that with the family. We're also in touch with the GPs. We visit them and meet with them at least once a month. And if they've got families that they're worried about, they will talk to their officers and the officers will go home and they'll do visits if we are worried about immunisation. So whilst we're not actually jabbing the babies anymore, it's a key part of our role. So yeah, and again, we do that in partnership as well with our colleagues in the children's centres as well. So it's everyone working towards it.
Just a question around the ASQs. We are doing a lot more work around looking at the outcomes in more detail. We haven't included the more detailed information for quality assuring some of the published data. We found an error in our data around the published data. So the information here is correct. So in terms of the take up of the 2.5-year reviews and the overall in terms of those meeting the 5 mandated the domains. But we, as part of our ambitions, we are looking at data sharing, being able to kind of share information between our IT services and internally within our children's services as well, to look at how the outcomes of children from 2.5-year review, how did that go towards improving mental outcomes that we're looking at development at age 5. We're working with our partner, with colleagues around the table, also outside on the best starting life strategy, and contributing to the 9% increase in the as well, and how we can do that better. So yeah, and we have a Power BI dashboard on outcomes, so we're looking at in more detail. Some of the data that's reported is based on those children who get the 2.5-year review by the time they get to 2.5 years. Later on in the report, there is a section that talks about catch up and catching children, even though it's after the 2.5-year review. The service makes sure that they continue to be invited and do come. So the service always does more checks than those that are due, say, within the month. So they are catching those children, but we will look at that in more detail about, actually at the end of saying, what does that look like, say, the next quarter, but
yeah, just to give some assurance that those children if we've got children with additional needs, any child protection or safeguarding needs, we do home visits for them, and it'll be more than just a 2.5-year review. So if they're not engaging with our services, we don't discharge them, we will keep working with them. And then we work with our social care colleagues as well. So every child you would consider to have additional needs or significant needs will be getting a 2.5-year review. And if they're not, we make a referral to our social care colleagues. So all of those, if we really do need services, we'll be getting the targeted approach, which is more than the routine. In terms of those that we don't get to see, we're doing, as Helena said, we're looking at our data and we're planning to look at what we call patient level data to do that comparison and share that information. That's quite new because sometimes we can't always share our information on our clinical records without consent. So that's going to help us to unpick that. We have a very mobile population, so when we have looked at it retrospectively, as see their patients, our clients that move abroad or have moved out of the area at that time. So yeah.
Thank you.
One final round of questions. Councillor Austin. Any further questions? Councillor Austin, take it away.
Thanks very much. I had a question on the health visitors, section 4.39 and 4.41 on maternal perinatal mental health visitors. 4.41, it's very much to do with relationship between the child and the mother. I had a question to do with the process the health visitor goes through before and after the delivery, and in particular about what information about the birth itself is routinely shared between the midwives, hospitals, GPs, and those health visitors.
It's a really good question. It's really important to us how we work with our midwives. So we get to know about women antenatally, and if they've got additional needs, then we will start seeing them at the antenatal period. So we do joint visits with our midwives as well, with the GP. So then we get the clinical information we receive is every new baby that's born, we get what we call a new birth notification, which will have the full information about the woman's delivery, her health and well-being, baby's weight, baby's information, all the screening that took place, the health test. We get that, all the information for every single child that's born. So we get that. It comes to us digitally to our child health information start, and then that's recorded, and then we take the health officer will review that information before she goes out to the visit. If there are complex issues, she might do a joint visit with the midwife or with the GP. So that will help a handover period if there's any safeguarding concerns. Was there any, is that answered?
Yeah, no, I think what I'm interested to know maybe then is who sends you that data and what sort of data are they collecting. My concern more broadly is that a lot of information around the actual birth that leads to injuries is lost within the first 4 hours because the patient goes through, the mother goes through different stages, different sorts of clinical professionals, and some of that information is lost. What I think we're seeing with some of these more national inquiries into trusts where problems have gone wrong is that things could have been identified or flagged and treated much earlier on, and it's much later on, sometimes weeks afterwards, where actually it realises there's a problem. And I'm trying to sort of tease through some of these, some of the midwives, hospital, they're not within the locus necessarily, the local authority, but the health visitor is. And it may be the health visitor 3 weeks later on, which is trying to unpick something which went wrong 3 weeks or so.
Look, the information comes from the maternity ward, so that's where it comes from. So it's shared with us, like I say, electronically. Is there anything else you wanted to add?
So when a mother's discharged, they are either sent home with a discharge summary or it's sent to us electronically. And if we don't receive it before we go into the home, when we get into the home, we will read it and use that to support with our assessment. At that initial contact, we do assess maternal mental health. We go back in. Depending on what we assess then, we could go back in 2 weeks later or invite them into our clinic, or we go back in at 6 weeks and reassess. So we work with the information we're given by either the parents or the hospital at the new birth visit.
Thank you so much. I wanted to thank you very much for the team for answering the questions incredibly comprehensively and for the work. Thank you so much.
Thank you, Hannah.
Thank you.
We will now resume the agenda as normal. We have item 5, departmental update. I again will be taking reports as read. If you want to provide a very brief summary, and then we will go straight into questions.
Thank you, Chair. The report, the departmental report for this this session of overview and scrutiny contains 15 separate items covering a wider range in CLA activities over the last 2 months. I do hope I understand the report 150/40, but gives a really clear insight into the range of work that has been happening across CLA over the specified period. So I won't go into it because of time. Happy to start taking questions from those who have the opportunity to read the report.
Thank you, Beth. I see straight away we have Councillor Austin. Any other questions on the departmental update straight off Councillor Carper? Councillor Austin and Councillor Carper. We'll go to you.
Thank you very much. The reports, I think, I'll probably go quiet now. I really actually from the minutes of our meeting in September, Becky kindly promised to include some information on the Armed Forces Covenant in this departmental update. Excuse my missing, but I thought see that. My question, I think in September, was we were just talking about exclusion rates. And I was wondering what data the council collected on service connected children more broadly under obligations. If it's review the next another meeting, I'm just thinking for a minute.
Answer that.
Yes, we got.
So the question, just like the first one is on the young carers. We know there's an issue identifying young carers, so I just wondered, since the new service started, do we know how many new young carers have been identified? I think I asked it last time as well. Do referrals go both ways? So if someone else identifies a young carer, is it referred to the school, not just the other way? And I understand that packs are being provided to the schools. Are they monitoring how schools use the packs? So do some schools possibly use the packs better than others and identify young carers or are more critical to young carers? And are all teachers aware of the checklist that's provided? So sort of, and also how many do you think are being missed? How many are you hoping to identify? So how long is this string kind of question?
That's not first.
Councillor, there was the most immediate meeting after the last overview scrutiny. We got from a bill picnic, and the information that we promised was provided because he felt it was more urgent for him to get it to decimate it out. I'm so sorry that we didn't include it in the departmental report, but because of that action, we felt that it would be circulated. I can, as an immediate action tomorrow, make sure the information that was sent will be widely distributed to all in the committee, and if it could be included in the pack as an addendum, I'd be very grateful.
We'll say that's on to Councillor McCarthy's question.
Now, I'm going to ask for some support from Christine. Are you happy to have a laugh?
Thank you. So, in terms of, if I go back a bit, if I may, in terms of how many young carers these do expect to identify, that will be part of the development of our new strategy. We want to refresh our needs assessment. So part of that will be looking at benchmarking good practice and evidence from other areas in terms of indications of what percentage of young carers we may expect to see in our population. And then that will inform the strategy development, and we'll be also engaging with young carers and with schools and other partners to make sure that strategy is fully addressing how we identify and also support young carers themselves and their families to continue to feel safe and understand how to self-identify and self. In terms of the work with schools, yes, I think referrals can go both ways. We have a very active provider, Carers First, who continues to offer workshops and ongoing conversations with schools and teachers. So, whereas I can't promise that every single teacher knows about the service, what I can assure you is that we have a very proactive provider who's recognised by Ofsted as being very high quality and proactively continues to go and support our schools. And what we can say is that we will continue to learn from that provider about what is effective in terms of promoting that to schools. So again, we can get to our new strategies.
Thank you, Chair, and as always, I appreciate Councillor MacArthur's interest in our young carers. It really is great to have councillors so invested in supporting some of our most vulnerable young people. I just wanted to add that since the last CYP, I had the privilege of attending a training that was put on by Carers First, a lunch and learn session that was aimed at addressing some of the points you made around disseminating information about how to refer a young carer and how to support a young carer within other institutions that they attend, like schools. And that training was attended by people who work in the education system, and they put together quite a helpful presentation on the level of support that they provide professionals who work with our children and young people. And what I can do is I can forward that presentation onto you because it addresses some of the points you raised from Kevin's first perspective, in addition to what you just heard from Christina. And as always, I appreciate your interest in the young carers.
Thank you, that'd be great. Thank you.
Good, I see hands again. Apologies, I've lost my order. Councillor Henry, Councillor Hall, Councillor Fraser.
Thank you, Chair. On page 189, and I just want if you would be kind enough to explain 5.3 a little bit more in detail for me, so I can understand what the changes and challenges are.
Councillor Hall.
Thank you. I wanted to ask a question about the wraparound programme on page 192. It's great that there are new places available that have been created. I just wondered, does every school now have these wraparound provision, and how is demand assessed at schools that maybe don't have it yet? Thank you.
And Councillor Fraser.
Sorry. 5.4. It's something that's about safeguarding. And as I'm wearing my badge champion as well, and we are wearing white ribbons. And so my question is, how successful has Merton violence against women and girls practically and teens been positively affecting safeguarding of children in Merton? Or if you didn't understand this, you are interpreting.
Councillor, I could understand it all. They yourself very well. And I think I'm going to ask Black, Elizabeth, could you support the answer to the item 6, the Ofsted framework, and the challenges that has presented? And also on 192, in terms of the wraparound programme, and I'll take the questions.
Thanks, Ben. So the new Ofsted framework is very, very different to the one that we have had before. So we will not have any judgments on the lines we have experienced for many, many years now. Outstanding, good, requires improvement. To have so many areas, it is, I think, very helpful in many ways to have that broader remit. And we're particularly excited by the fact that Ofsted do want to look at the inclusive nature of our schools and our settings. Nevertheless, the introduction of the new framework is a challenge to our schools and to our settings because it is so very, very different. And the stakes that are associated with, I think these were good, but good and better outcomes for the community, for staff, for parents, for children. The accountability around that is significant. So head teachers and governors are taking this very seriously. They're looking at what the criteria are for those stronger outcomes. And looking to assess themselves against how they feel they currently deliver for children and families. So there are challenges there. Members of this committee may have heard that the unions, head teacher unions in particular, have challenged and wanted to seek judicial review about the way that Ofsted had gone around creating its new framework. That challenge has not been successful, but it just goes to show the pressure our leaders will be feeling to be able to do it well. I think, obviously we are going into this new framework of all our schools under the old framework having really better judgments, so really strong starting positions. And we'll be working to support, I know our colleagues in the school improvement team have already done a lot of work to support schools, and I should say in our early year service as well to support our settings. With regards to wraparound, it's not 100% have got wraparound care A couple of schools have pulled back from delivering, and I forgive me, I can't remember if breakfast clubs or after school clubs, and that is because of the viability of those clubs. But with the additional capacity that we have in our service now to support schools around this, we're seeking to maximise the offer from other primary schools. But it is a strong offer. Many of our schools have delivered that provision themselves. They are committed to the strongest possible offer, again, for children, not just in the main school day, but before and after school as well.
Thank you.
And so the question, the final question in that round relates to the impact of ball, and whether we can see the impact in the experiences of children who may also experience those things. I do believe in my own involvement, and I chair the Ball Strategic Board, is that we continue to have a number of high pressures of domestic abuse and children who experiencing domestic abuse. The new Ball strategy that has been brought together and will soon be published really makes an effort to put a capital G in the book, so that girls are just as important and on equal footing to the resources and measures and the strategies we want to deploy out as women. And I think that the range of services being brought in to support the board strategy will absolutely start to answer to the questions and the feedback we've got from children, young people and their parents and carers, and the impact measures that we're designing now and see in the action plan underneath it will give us the evidence in time as to the value that the change in the strategy creates. So in terms of the new strategy, it's too soon to answer that direct question, but I want to thank many of the councillors that have contributed to that full strategy. It's been a comprehensive and extensive consultation period. And I think it's been broadened out this time, care from children and young people, which is part of what gives us confidence that the point around participation and hearing the voice of children is very evident in a high risk strategy, and it was achieved here in Morton.
Thank you very much. Any final questions on the departmental update? Councillor Coffer, Councillor Henry, then I'll say.
Thank you. Page 196.5 is about the early years settings. It said 2 settings judged to be less than good. I just wonder how often they were assessed, and is that something that's happened before? And also, I had a meeting with Bev and Elizabeth, so I know that you know about this, the concerns raised by some early year providers about the funding. And were the concerns addressed, and have any early years providers closed because they're not accepting funded places? Has that made any difference? And sorry, just very, very quickly, it's the Words of Affirmation campaign in National Care Leavers Month, which I think sounds brilliant. Is that something that councillors were involved in? Could we have sent that, or is that just from us? I just think it'd be great to be able to do that. I just wondered.
Rolling 3 questions into one, then. Let me just answer. Councillor Henry.
Okay, thank you. Page 193 and 9.3. Can you explain a bit more about the during the school term and the voucher that have been received from different sources? Is that going to be continued for a little while? I know it means 2026, but how long will that continue for?
And then yes.
I'll be referring to 14.1 on page 106. So I'm asking about the multi-agency audit. When looking at areas for improvement, have you asked young people about what they think can be improved in these kind of education? And when you're talking about closing the feedback loop,
I also feel like the young people changes that have been made to benefit them.
I understand there's a lot to unpack there, so please.
We'll take our time and get there, but I'm so sorry. For me, you faded at the very end and I don't want to get your question wrong. Would you mind?
That's fine. At the end, it was talked about have open the feedback loop. I was just wondering if the young people, that information has also been, if the young people say that this is what we've improved, based on their feedback, we can get the feedback about what can be improved in this service.
So I think, Elizabeth, could you take the hand voucher question?
Yes, so we have got control of them. Yeah.
It's me.
We have confirmed funding for the national programme for and I'm very pleased to say, as you would have read in your report, that take is very strong. I just really wanted to focus and highlight, I suppose, the uptake of our children and young people who send, which is growing stronger every time we do it.
Shall I talk about the settings judged to be less than good as well?
There are a number of different ways that our settings are supported by the early year service. There are annual audits around safeguarding and also around inclusion. We'll be doing an ongoing programme of support for the many early year settings that we have in our local area. Periodically, we do have settings that are judged to be less than good. And you can understand that a number of them, particularly childminder, are on their own, around the vulnerability, around the big Ofsted framework, sort of everything that they are choice. But we are doing everything we possibly can to support those settings. And in terms of the concerns about funding for the year settings, I will, if I may, just go back and double check, but I would want to reassure you that since the introduction of the extended offer and the clarification, because the funding rules will not change, it was clarification around funding, which we have to then pass on to our settings, the sufficiency of our in the early years is something we're constantly keeping under review. We have to do a formal sufficiency review every year, but in the interim, we're also looking to understand and check that parents have got the care that they need.
And I think in the offer to come back around the early years, whether there's been any adverse closures, could we have your grace to send a written report on that? We're not aware that there's been, but I want to double triple check before meeting and answer tonight. And then on your point around the words of affirmation and the care leaders month, I think that there's been our lead member certainly has been involved, and David might give us a bit of an update as to what else filmed on there. Which is good.
Yes, it's set out in the report, but definitely with the words of affirmation. I mean, I'll talk to Rosemary from tomorrow, and we'll see how we can how we can get involved in that. Absolutely.
I was thinking, as we're all corporate parents, as councillors, it would be nice if we could be, if it's appropriate, that was all I was just wondering.
So Steph is absolutely right. I was involved in that campaign, and I know how seriously all councillors take their role as corporate parents. And so the message I sent wasn't just on my behalf, it was on behalf of all of us as councillors. And if the chair would allow, I'll just read a short snippet of that message and see if you approve. That's cool. Thank you very much. So, of course, also with Happy Care Leaders Month, I just wanted to send you a personal message to say how proud I am of you, not just this month, but all year round. All of us as councillors really care about you and are 100% invested in your support and your success. You are and will always be part of our nursing family, and we are rooting for you, even on the days when it does not feel like it. And that's what the short snippet, it does go on and on and on, we are counsellors. But I knew that that is a message that all of us will approve of. And I do appreciate you asking what way to be watching supporting our children in care. And you might know Christmas is on the horizon. And so I will be reaching out very soon about sending messages to all of our children in care to wish them a festive break and any other appropriate messages to them. So you will very much, as will everyone else, every member around this table, be involved in that. Thank you, Councillor. Not a dry eye in the house. That's nice. Thanks for saying. Thank you.
Chair, I just want to know that our colleague online is fine.
Apologies, Secretary.
I just want to know that our colleague online is fine.
She looks asleep to me.
Here in a minute. Are you okay?
It may be that it's late, so I just wanted to check.
If anyone has a personal phone number, please get in contact. That would be much appreciated. That's a welfare check. I will proceed with the meeting now, but if anyone does have personal contact details, they can please get in touch and confirm well-being would be much appreciated.
Thank you, Chair.
We will move on then to item 6, the my apologies. This is the answer there.
And you've told me twice what your question is, I think.
I believe that's right.
I'll just refer to,
Yes, I.
yeah, perfect. Isn't that completely when you consult looking for the areas of improvement where young people got something about it and where you're putting that feedback back to those who do the services, are able to tell young people about these are areas that need to improve based on your feedback.
Really, really helpful question, and it's one I know that you are holding as the champion, because this is the same debate that we had at the Children's Trust Board, that if we ask, we should have the courtesy to feedback the outcome of what we expect. I do think that's an area we need to do better. There's an improvement that we can do better in. I think the feedback is that is provided is not consistent. And I would like to take this as an item of the Children's Trust Board so that we can sign off the process to ensure that feedback is part of this new way of working for next year in a revised participation approach.
Thank you. Also, as design I had thank you so much.
Yeah, thank you very much. Some very important questions, very important issues raised, and really appreciate you being here, even if it's just for the evenings. Great to have you. Thank you very much.
Chair.
Sorry. Elizabeth, and then I'll go to Councillor Henry. If we could get that microphone there turned off, so it's putting in.
I asked the question of my colleagues who are working late tonight about numbers of nurseries that have shut, and they've come straight back to me and said 2, but it wasn't to do with funding issues, it was to do with low numbers. Thank you.
It's brilliant and speaking resource. Councillor Henry.
I'm not sure if this is appropriate to ask now, but I'll ask if you can stop me if you can, if you feel it's not. Councillor, was you went to Housing Insight, can you just give us some feedback and what your visitors and the outcome is?
Yes, please.
I love that question. And I also appreciate how much you pushed for me to do this visit. It's been a long time coming. And I'm glad that I was able to visit it on an evening where it was quite busy. There were a lot of young people getting involved in sporting activities, having a hot meal, catching up with their friends. I could see just how valuable that youth centre was to the young people around Pollard's Hill. And so thanks again for encouraging me to see the centre as early as possible. And if there are any other activities happening in Pollard's Hill that you would recommend I see in person, please let me know.
Thank you. And I just like to add to that as well as someone who attended recently. The thing that most surprised me to delight is that there was not a single room that was not being used for something, whether it be sports activities or dance activities, it's something else. It was always being occupied and used by someone. That's a real discount to the people at the Neurolist Centre. We will now move on to item 6, performance reporting. But if we do take the same procedure, if you'd like to give a brief summary or a brief update, and then we will proceed straight to questions.
I have the pleasure of handing over to Maisie Christine.
Maisie and Christine, then we will same deal.
So this is a regular performance report the members receive. So their children are from learning and families. So yeah, it's a sort of overview of our performance and some key areas. Thank you.
Thank you very much. And straight to questions from councillors. Councillor Hall, any other questions straight away? Councillor Hall, please.
Thank you very much. I thought it was a very good report, and I was particularly pleased to see the 97% of EHCPs issued on time. That's a really good result. I just wondered, is there a breakdown of how long the assessments that didn't quite meet that, how long they were taking? If you could answer that, that'd be great. Thank you so much.
And if I can just add, what methods we use to increase the number of EHCPs, just to give a good example of good practice.
Should I take? Oh, sorry, yes, I'm just thinking.
So I can't give you a breakdown, Councillor Hall, at the moment in terms of how many are going, of those that are going over, how far they are going over. I think as we talked to assure in previous meetings, there will often be reasons in terms of wanting to make sure that we get the plan right and working with parents and parents in a very mindful way and wanting to work with them. In terms of increasing the EHCPs that are issued within 20 weeks, increasing that proportion, this is a partnership effort. Talked a lot today, lots of different spaces about partnership and how we're coming together for the sake of children and families. And this is about wanting to work, so we are working with our health partners to ensure that the advice that they provide is on time, likewise for children's social care, likewise from education colleagues, because it's the timeliness of the advice in particular which allows us to issue the plan within the specified 20 weeks. So I can't do that.
Thank you very much, Elizabeth. Any further questions from the councillors? Councillor MacArthur. Councillor MacArthur.
Thanks to Jess, not for
As you're the sole questioner right now, I will allow you 2 questions.
Thank you.
One is to do with school attendance, which is great that we're doing so well. I noticed in special schools we're below London and national in terms of attendance, and I just wondered if there was any reason why that was that you knew of. And the second one, I'm not sure if it's the right place to bring it up, But because you mentioned youth justice, I noticed the youth justice system in Merton was rated as requiring improvement by the Inspector of Probation in June 2025, and I just wondered if you had any comments on that. But it's not the right time to bring it up, please, Tom.
Please go ahead.
So with regards to school attendance, as I have shared before, we've got a relatively small number of special schools. So when we are looking at averages, we're looking at relatively small proportions of children. I think it's worth also saying that we have obviously our special schools have specialisms. So at Perseid, many of the children will have health needs, which will sometimes make attendance, sometimes because the school works very hard to make sure that they do maximise attendance. The health needs will sometimes prevent children from attending regularly. And then with Melrose, supporting more of our children who have social needs, for them attending school can also be a challenge. What I'd like to reassure the committee of is that all 3 schools have been inspected relatively recently, and their attendance processes scrutinised by Ofsted. And as you may remember, both Perseid and Green have answered outstanding, and in Melrose inspection, the attendance systems were scrutinised and found to be strong. So it was a combination of needs and relatively small numbers, but nevertheless, none of us are resting on our laurels.
With regards to the youth justice.
Yeah. Yes, just quickly. I mean, absolutely. So it's been a lot of work since that time. So I won't go through it all. But we have ordered someone to do the way day service and to reset the board. There's been a lot of work on ordinance functions, oversight of the service. We've ordered a new service manager, Jennifer Williams, who's a really fantastic reputation and is working with the notice of service as well. And she was the person that brought us to good back in 2022. And yes, and of course, we've done HMIP sort of action plan back to the inspectorates and their responsible to this very robust plan.
Thanks. I just wanted to ask because I think it was said that obviously we were one of the first people to be assessed under the new terms, but there was an issue of best practice where the one particular element we actually thought we were really good on, but we fell down in another area. What were the areas?
Yeah, absolutely. So we were the first local authority to go to be undertaken within this, and they assess the 4 domains. One is victims, which was the new domain, and we scored good on that. The other 3 areas, they looked at 15 children, and it was across assessment, planning, and delivery. In each of those categories, they looked at the outcomes for the children, so achieving better outcomes for the children. And the second one within each delivery was delivery safety for the child in the community. For the achieving outcomes for the children, we were rated as outstanding across all 3 domains. And achieving safety for the children in the community, we were rated as requires improvements in 3 domains. Because of the new methodology that they were testing, their methodology clearly says when there is a disparity between the 2, they knock down to the second one. So that was the methodology of the, but it was needless to say they found numerous sort of good examples of good and strong practice with it. So it is, thank you for bringing that up. It's really important to note that it is a new methodology. Testing. We have been a part of roundtable discussions as well to sort of help other local authorities prepare for the inspection, but also to think about, sort of how it's working. And just sorry to go on, it's very late, but of course, Ofsted, we're also looking into across all the services, including sort of exploitation in return, and then our sort of response to to contextual safeguarding, and they found us to well, the outstanding. So there is assurances about it.
Please go and get them. Just to say, I heard there was one element that we did perform extremely well, in so much so that the assessment wanted to use us to do long-term best practice. It is a shame that the timing seems to knock us down a bit more than anything else.
Thank you, Chair, and I'm glad that you highlighted that point because this, and also thank you, David, for giving that overview, even though this is not an agenda item and we don't want to stray from the agenda, but of course, your prerogative as chair. I cannot stress enough how nuanced this report was, just from the examples we just heard. And alongside the areas where there were recommendations, and as a learning authority, we do take on any recommendations we receive because we want the very best service for our children and young people. But alongside those recommendations, they also did find that as part of our youth justice service, on all levels of the partnership, they found the staff to be kind, caring, and very committed to achieving success for all of our children, and that our practices in supporting our children were child first, trauma informed, and that led how we supported our young people. All things that we can be proud of as an authority, and where we can be even better. We want to be, which is why we've got that action plan that David just went through. But it was a very nuanced outcome, and anyone who's interested in fully understanding that nuance, I recommend read the full report. Thank you.
I actually did read the report and I agree with you, it was nuanced, but I just think it's important that we know what actions are being taken for where it says it requires improvement. As a board.
Agreed. Thank you very much.
My last one.
That's it, Councillor Henry. Any further questions? Councillor Henry, Councillor Hall, and then we'll end this item.
Thank you, Chair. My last question.
Microphone.
Okay. On page 209, 6.7, and it said 3 children were permanently excluded from secondary school in September, but it did not say what supports are in place for them while they are excluded. Can you please explain, please?
Yes, Hall.
Thank you. Yes, I've got a question about tribunals. I note that we've received 41 new appeals with the first tiered tribunal. I just wondered if maybe in a future meeting we could have a report on the outcomes of tribunals and also the cost to the council of the tribunals as well. And I don't know if I'm being thick here, but it said since January we've received 41 new appeals and we currently have 40 active. So how does that work? Do the 40 active include, or is it 81 altogether that are now active? Thank you.
Discussions and tribunals, please.
So when the child becomes permanently excluded, we have a responsibility to ensure that they are receiving educational support, and we ask our crew, Calgary College, Canterbury campus, to provide that support for children. I just also would like to add that our inclusion lead, sitting within the Education Inclusion Service, works very closely with schools when there are threatening to be exclusions and when exclusions happen. Support being there to make sure that children are supported as well as possible. I'm sure that we would be able to bring a report about tribunals to this panel, perhaps as part of a departmental update. We can bring that in. It's not 81. It's essentially that would suggest, but I will just check that of the 41 that we've had new, one has timed out or been resolved in the meantime. We've still got
So it's just the
40.
40.
Yes, that's exactly.
Can I just please, sorry. Can I just please ask that when our children are excluded and whatever services are in place for them, it be documented so we can, read and understand it, because here it wouldn't say anything. So, yes.
What's your
Councillor Henry, I could just, I was sitting there on Keith Shipman the other day and looking at the exclusions. Also, I don't know specifically about these 3 children. He runs children's and education, and there's very sort of high oversight of all children sort of out of for any reason. And there's vast majority of children that have experienced any form of experience like open social care, and there's a very good understanding of what their social, their health needs, their education needs, and those needs meant to make sure that there is a multi-agency network around those children and their family to support.
So as long as we know there's a
On to item the SEN student. Once again, brief overview and then straight into questions.
Chair, I'm going to just invite Tom to come straight in and pick up the question that was put as part of the ATO.
Yeah, so I'll attempt to do that as part of my very brief summary. So yeah, we transport over 700 children daily to school and college, costing over £8 million a year, going to over 120 schools. So it's quite a big logistical area. So the report sort of goes through the eligibility criteria for that, and then I've summarised some of the initiatives we've done as part of sort of efficiency planning. Firstly, of absolute paramount duty is the safety of children, and I've outlined some of the work we've done on that. But in terms of some of the efficiencies and making the service better, done some work on the eligibility and linking that to independent travel, encouraging children who can to travel independently. A lot of work recently, and perhaps the biggest savings we found is what's called route optimization, which is making the logistics of the routes as efficient as possible. We started using the IT system over a year ago, which is sophisticated in planning those routes properly as efficiently as possible. Before that, we were using sort of Google Maps like everyone else, but when you think of the logistics of 700 people being transported, getting those in the routes that's appropriate for the children, so the journey's not too long, but doesn't put people in single taxis too much, is important. And lastly, getting the school placements local. Lots of work's been done in trying to get additional places. Clearly, if you're transporting people a long way, there's an inevitability of travel. So that sort of answers the question of what we've been doing and what we're doing in the future to make the efficiency savings that are in the council's proposal to do this route optimization twice a year. So we'll review the routes because they're children that become eligible through the autumn term, and then that means that you end up adding them on to single taxis. So by doing that reappraisal, that does allow us to make those savings. We are going to appoint a specific travel training officer in addition to putting them on a programme of travel training through MenCap. The advantage of that is that it looks more strategically working with schools to have that general ethos of trying to train people that if you can travel independently, you should do so, and there are programs for us. And there are also some other means of alternative commission we are looking at. So yes, I'll open to questions.
Thank you very much, Tom. Very well summarised in a very short space of time. Straight to questions. I see Councillor Hayes. Any further questions? Councillor Hayes.
Late chip of my question. But what's the system called? I understand so what if you do know the system called clearing interest and negotiate with you set value for 27 million addressing 92,000 staff? the big saving for all men. Got any idea what size of saving? And it's different because of kids in school. But I wondered any idea what kind of level of saving it might produce?
Well, I suppose it has. If you look at the table just above paragraph 4.18, that's the savings we've actually made over the
What page is that? Sorry?
page 231. So that shows that whilst you'll probably have seen it in the news, a lot of councils are struggling with SEN home school travel budgets going up. We've actually made savings. So we spent £8.85 million in 23-24 out term, but we're forecasting 8.3 million. So that's actually a 558. We spent 558,000 less than 2 years ago. We're expecting to this year. And if you add on the sort of the impact of saving, that's the sort of real term saving of roughly £1 million. So a lot of that, the majority of that, has come from that route optimisation from the new system. To some extent, it has been that we are because of the independent travel and the eligibility. You can also see from the table above, we are transporting slightly less children than we were 3 years ago. So 20 less children, down from 77 to 707. But the greater savings we have made is in those logistic differences.
Just a supplementary, you mentioned about ability to get children and go to school. What I know it's a route optimization, so it's just looking at class switching different groups. Is there any overlay on that? But kids that might have, big difficulty.
Absolutely, yes. No, I mean, we talk in a like it's like that we're not transporting children, but absolutely that is thought through very hard, and a lot of children have to be still on single taxis because of their needs where they can't transfer. So a lot of children can't sit next to other children because of the stress they have in the journeys. So a lot of variables is put into that. It is not just a matter of sticking on children into a taxi. It is looking at their individual needs, assessing their needs, and having those. So there is that system works a lot, and there's lots of those variables which you put into that system. Understanding all applications are made on the individual merit of children understanding. So we do have good understanding of those children, putting that in. Sometimes there is some trial and error. Sometimes we do find we don't get it absolutely right, and we do have to therefore move children where they're put into sort of shared transport and it's not working. So there's a lot of work with families and children to get the humanity right, as well as obviously that clearly a single taxi to a great distance, it costs a lot of money. So it is getting that absolute balance of meeting the needs of children. Plus, obviously realising that it costs a lot of money to transport children to school.
Thank you. Any other questions on the SMN? Councillor MacArthur?
It's only a quick one. It's just, I suppose I can see that you made really big savings between 2024 and 2025, and then it sort of broke down a bit. Have you not already done as much as you can, as in if you've done the optimisation, can you really make more savings this year than you did last year? So where are you, the buses stay the same, basically, and things have come down, but have you already done as much as you can you really make that much more savings?
I mean, that's a fair point. Like all savings, when you do things first, you do make the easiest ones first. The saving that we've given, I think, is achievable at 210,000, and in some ways it is ingrained in the system by the fact that we'll have the full year impact of some of the things that we've done since September. So yes, absolutely you can't. It's not something you can. You can keep making savings on forever. But I think the saving we put in there was a reasonable one, and that's why I put in.
Any other questions? Councillor
Just a quick one. The dynamic purchasing system. Can you give me a very brief explanation of what that means?
So dynamic means it can keep moving. So it means that taxi providers can join if you like, a framework of an approved list at any point, and once they're approved. So it means unlike a framework which is fixed at a time, and therefore there's a approved list that's fixed for a number of years. The number of providers can come in as long as they're approved at any time, so it can grow. And then what we do is we do a mini tender within that, all those approved providers, and they have to be approved to meet all our needs and safeguarding, but based on them being reasonable, then it's bid on a price basis.
Any other questions on this?
Sorry, I don't have a question. I just want to say thank you for your service because I have a family who do have children who travel and transport and they feel safe, they feel secure, and also they feel comfortable that their children will be delivered at their door, without traveling, especially this time of the night, dark hours by themselves.
Thank you. I mean, it reminds me, we did receive a really lovely letter actually from a family only last week who had actually thanked us for the support they've had throughout the getting them to school, but also that person had gone through the independent travel program and now independent. And it was a lovely success story where we sort of supported them as they needed them through the transport. But as that child grew up, they became independent and were able to travel independently. So, well, thank you. It reminds me to blow that as a nice compliment we got as well.
That's great to hear. Thank you, Tom. We will move on now. Item 8, the Lado annual report had been just presented in the meeting. We've already taken item 9. So on to item 10, the safeguarding, to which I'd like to invite Justin to speak. He's online. Thank you, Justin. And we will again, hi Justin, we will again go to, if you'd like to give us a brief summary and we'll go straight into questions. Thank you very much.
Yeah, brilliant. Thank you. Sorry that I'm not with you. So you have in front of you Merton's Safeguarding Children's annual report for 24-25. Hopefully what comes through the report is that you can see the and I think as has been agreed with Ofsted, you can see the sort of golden thread in terms of the learning from the reviews and the cases that we have going through from safeguarding through to the actual implementation and learning. So if you look at the sort of VAMP review, which was our sort of key learning review, our sort of key safeguarding children's review that happened in that year, in terms of the sort of learning that's come through in terms of the practitioner event, following on from that in terms of the sort of engagement and the scrutiny sort of elements as well. So looking at the sort of lived experience, looking at the sort of learning and looking at how we can have difficult conversations, how we can look at services and adapt services to meet the needs of children, young people who haven't necessarily engaged within services. So you have that thread running through the whole of the report in terms of the learning from different reviews, the learning from the sort of the cases that we've had, and also in terms of our scrutiny work and the work of the young people's sort of scrutineering involvement element. So looking at a lot of the themes that come through from the scrutiny in terms of again, the engagement around services. And I think as Bev sort of highlighted earlier in terms of things like VORG work as well, in terms of the VORG strategy. So again, a sort of feeling of very much the sort of children, young people engagement in all of the different elements and strands within the safeguarding work. Within so yeah, the sort of voice of scrutiny and children, young people is very strong, I think, through all of the report, and I think that in terms of our priorities, they're sort of outlined and detailed within the report as well. Again, very much the voice of children, young people through that, looking at our incidents, our issues, the key areas that we're needing to work on, making sure that we're strengthening the voice of education throughout our partnership, and also clearly in terms of the family first work, in terms of strengthening that sort of early support for children and young people and for families as well, and a sort of a real think family approach. So I think, as our scrutineer put it, that actually hopefully this report reflects the sort of maturity of the partnership and also the sort of focus in terms of collaboration and commitment to make sure that children are safe and supported. And hopefully that comes throughout the report itself. So I'm happy to take any questions, and I know that there's probably a few people around the room who are also part of the partnership as well, who can probably answer a few as well.
Just straight questions from the room. Might be a that's all.
I don't want you to get away with my questions. A very quick one. It mentions in the report that the NSCP will seek to work more closely with councillors to make better use of their knowledge of local issues and strong community relationships. I'll just say that's great. Thank you so much. And how?
I suppose, well, we have we do have a lot of council engagement in terms of the LSCP, and I know Summer may want to sort of add to that. I think that there is an element of strengthening our relationships clearly through these type of sort of committees and overview and scrutiny. I think, but yes, certainly in terms of sort of views and scrutiny, we need to. I think councillors are very involved and engaged, and we've involved and engaged councillors through the sort of annual our AGM, our sort of work across. So hopefully, yeah, that is sort of reflecting on ongoing work rather than necessarily needing to increase that.
Definitely, Chair. Yes, that was put in the report because all of us have a safeguarding responsibility to our residents, and as councillors, we are on the front line. We do engage often with residents who bring a multitude of issues to us, and as a councillor, if there are any issues flagged with you that you consider a safeguarding risk or something that we should consider as a partnership in terms of how we as a borough safeguard all of our children and young people, then I would hope that you would raise that with the appropriate person or bring it to myself if it's something that we need to include within our partnership. And the partnership has proactively tried to engage a wider group of people in the work of the board. Quite recently, Maisie ran a training on what the Merton Safeguarding Children's Partnership Board does, and the role that not just elected members, but other members of our community that interact with our children and young people can play. I attended the training to make sure other people were also attending, and we did have a selection of people from different backgrounds and different professions attending that training, and Councillor Hall, if you or other councillors would want a similar training conducted, if you reach out to me, I'm sure we could find a way to involve you more in the work of the Safeguarding Children's Partnership Board. As I said, we all have a role to play in keeping all of our children and young people safe.
Thank you.
Yes, I think it's just really important to say that the old mantra used to be safeguarding is everyone's responsibility. The new mantra, particularly when we start to roll out the new reforms, is that safeguarding will be everyone's business. And so that line in the NMC report is to ensure that the frontline reference that I did allude to earlier is really understood, the reliability. If we tilt the system back to prevention, the contacts that the council have in the community, you'll see and hear things that perhaps other parts of the agencies won't. And we are relying on you to make safeguarding everybody's business.
Thank you very much for that. I think it's very true that one of the main responsibilities of being a councillor is connecting people to the right people.
Yes.
Very much goes to safeguarding. Any further questions on this item? Very much. We move on to item 11, the work programme. It's my understanding that the next meeting will have round to budget scrutiny, and the postponed low report should come before us in January. Are there any other additions or changes to the work programme? That's received. Thank you very much for that. My personal thanks to everyone for persevering with the seating arrangements in the room. I understand it's been put together and the sharing of microphones. Thank you all for doing so. Thank you all for attending tonight's meeting, and I'll formally call this meeting to a close.